Hello everyone, welcome to today's video. My name is Dr. Rishabh Jain, and in this video, we'll discuss about dermatology as a branch for the upcoming PG counseling in both INI-CT as well as NEET PG. So today I have a very special guest with me, Dr. Anubha. Dr. Anubha was a colleague of me from PGI Chandigarh, where we both did our MDs. So she did her MD in dermatology from July 2018 batch, and I did my MD in radiology in the same batch of July 2018. So hi Anubha, welcome to
Hi.
the video.
Hi, Rishabh.
Hi, how are you?
Yeah, I'm good. All fine.
Yeah, so Anubha is currently a senior resident in the Department of Dermatology at PJ itself. So, uh, ca- so just a brief introduction about Anubha. Anubha is a graduate of the prestigious JIPMER, and she got a single digit rank in PGI PG during her time, and her first choice was dermatology, and so she took dermatology by choice. And so I thought it'd be interesting to know about her perspective of dermatology, why she chose the branch, what does the branch entails, and uh, how does she feel about it. So Anubha, over to you.
Yeah. Okay, so I would say dermatology is considered to be a very niche branch because you don't get a lot of exposure in dermatology in your UG days. And again, I think you have spoken about this in your previous videos as well. And generally, students are interested because it's also an N branch. So yeah, so for people who do not want to study more or give more exams after MD, it is very beneficial and it's generally eyed by the top rankers. So the reason I was attracted to dermatology a lot is because it is a very visual branch. Then you don't need to know what is going on inside the body, and there's nothing hidden, there's nothing cryptic. It's all on the surface.
Right,
So you can, like, this is actually the branch where you can see the patient and you can give your diagnosis in a second, in a split second. So
right,
and
right,
so I find that really fascinating. Like, with experience, the more you see, the more you know. So I found that really fascinating, and I started liking dermatology when I was in MBBS itself in Jipmer. We used to have a 2-week posting, and then so during preparation, also PG preparation, also I was like focused on dermatology, and I knew that I wanted that.
you wanted dermatology, all right.
Yeah, I wanted dermatology. It was my only choice.
All right. Yeah. So as you mentioned, I think dermatology is very few of the branches which are actually end branches. Like if we
Yeah,
right, because I don't think that there is much need to do any fellowship, like a
yeah.
compulsory need. If
Hmm,
you
hmm.
have a good JR and SR ship, I think that suffices.
Yeah, you can manage the most common things, and you can cater to like maximum diseases if you've done your JR ship and SR ship. I think that's more than enough.
Yeah. So what are the subspecialties of dermatology?
Okay, so the subspecialties actually in matlab, even now there is not much need for subspecialization, but if you really want to go further, there is aesthetics and cosmetology, that involves your botox and fillers, and it is like developing more and more these days. There's mesotherapy, there's this derma roller, and people are going into facial augmentation and body augmentation, and even liposuction is done by dermatologists, hair transplant obviously. So this is one aspect of it. Then there is core dermatosurgery per se, in which
Okay.
you do cyst removal, mole removal, and you can do revisions, scar revisions, and facial restoration surgeries and reconstruction, or earlobe repair. Like, you get the gist. So
Right.
that is one aspect. It is core dermatosurgery, and then there is lasers. So lasers and dermatosurgery are generally clubbed together only. Lasers, dermatosurgery, aesthetics, and cosmetology. So generally, when people practice outside in private setting, they tend to incorporate all these 3-4 branches together in order to establish a good practice, because they kind of go hand in hand,
Okay.
right?
Oh,
And
right.
yeah, and apart from this, if you want to stay in institute and you are academically oriented, then there is dermatopathology, which is a
Okay.
collaboration with dermatology and pathology. And then there is pediatric dermatology, and then there is different fellowships. If you are you want to go further, there is fellowships in contact dermatitis, there is fellowship in immunobullous disorders, and it just genodermatosis, genetics, so it just
Okay.
goes. Yeah, so
Okay.
yeah,
So
you get the basic.
right. Right. So it has both. It can cater to both an academic person if he
Yeah,
or she wants to go into academics. So there are further
yeah,
subspecialties, or if you want to like go into private practice and earn like
yeah,
a large amounts of money, there are other options as well.
yeah. You're right. You're right. Yeah,
Okay. So we'll now move to the residency per se of dermatology. So like you
yeah,
are currently doing, you did your PG from PJ Chandigarh. So how was
yeah.
the residency structured in terms of working hours, in terms of academics, patient care, patient exposure, etc.?
Yeah. So I would say the residency at PGI Chandigarh is very extremely well structured. You know, it is, I don't know, I would feel that it's the ideal structure for a residency. Like we have inpatient as well as outpatient exposure. So inpatient is only for the first 6 months, you know, where you see admitted like serious cases like sick psoriasis, erythrodermas, pemphigus, drug rashes, and some connective tissue disorders and all sick connective tissue disorders. These kind of cases are admitted. So you get ample exposure, and in this you can incorporate your knowledge of internal medicine as well. So
Right.
in management of the patient, so
Right.
it is very fulfilling that way. And the working hours generally, when you are posted in board for the first 6 months as a first semester JR, generally you come in at around 8 o'clock, 9 o'clock in the morning, and you leave by around 8 o'clock, 9 o'clock in the night. So 10 to 12 hours maximum, not more than that. Even night duties are extremely rare. In case you have one sick patient who's intubated or probably unstable, then only you get night duties.
Okay.
So this is for the first 6 months, or sometimes 8 to 9 months also, depending on the number of residents you get posted in the ward.
Right.
After that, you're posted in OPD. It's only majorly an OPD posting. So OPD mein there are different kind of postings. Like in, the junior most JRs will be posted in file making. Then you will progress to sitting in the follow up clinics. And then after that, you will progress to sitting in the general OPDs, where you will cater to all the patients. Apart from that, we get a good exposure in minor OT and dermatosurgery as well, and lasers as well. We do perform the basic dermatosurgical procedures, basic minor OT procedures, and lasers bhi hamare paas. We have a carbon dioxide laser, we have a diode laser, and NDI laser, and intense pulse light laser as well. So you get kind of you get a hang of what you want to do in the future, because you get exposed to both the like a little bit exposure to the cosmetology part, and obviously a very good amount of exposure to the general and clinical dermatology part as well.
Right.
Now coming to, do you want me to speak about academics as well?
Yeah, go on, please.
Yeah. So coming to the academics, in board, obviously we do get a little less amount of time to read up intensively, but then we have a habit that is inculcated, that is especially the question answer sessions that occur in rounds. So that kind of encourages us to keep on reading more and more about the patients who are admitted currently in the ward. And as you move on to OPDs, we have seminars regularly in our academic sessions. We have journal clubs, we have case conferences where interesting and difficult cases are discussed. We have a bedside case discussion that is taken about for the exam cases per se. We have a grand round on Saturdays, which are like extensive discussion about a very interesting case or a difficult case that is difficult to treat. So academics ka exposure is very good. You will be thoroughly interrogated on all topics, and it might seem a little daunting in the department. There's a lot of pressure on you to perform academically well in PGI, but it actually pays off. You read up so much that at the end, when you leave the college, you leave with a very good amount of knowledge of dermatology. And as far as patient exposure is concerned, we get a very good inflow of patients, not too high that you settle OPD till 5, but a good mixture of all sorts of cases, like classic textbook cases, even rare cases of genodermatosis, rare diseases that have only 1 or 2 reports. Even such cases we get to see.
Right.
So our clinical acumen develops a lot. Like I have felt that doing residency here has given a lot of clinical judgment. Then we become equipped to take independent decisions also. Like if you set up your own independent practice, it often becomes difficult because you've always consulted your senior resident, always consulted your consultant. So as a JR also, you become equipped to make independent decisions and take treatment calls for your patients. So that is very good. So overall, it is structured really well. The residency is structured really well.
All right. So what are the working hours? So like, because
Okay, so
PGI is very famous because dermatology ki residency is like chill than my MBBS. So like I want to hear about it.
Yeah. So like I was talking, like in ward, obviously it's a 10 to 12 hour duty depending on the condition of the patient. But once you move on to OPD, it's kind of like morning 9 o'clock to afternoon 1 o'clock. That's the official kind of semi-official working hours. Officially it's still 4:30 in the evening,
Right.
but you do finish up by 1:30 on lighter days, and maybe 2:30 on slightly heavier OPD days. Obviously after that, depending on your thesis and your academic work, you do tend to stay back, for your thesis patients and all till 4:30 some days, and you have a lot of academic work. Sometimes case conferences and all go until 4:30, 5 o'clock, and evening classes and all go until 4:30. So that is there. But official working hours, like for seeing patients and working per se, is still 1 o'clock, 1:32 maximum.
Wow, like that's great, because I don't think I don't think I've heard anybody say about such chill working hours, especially in a central institute. Also, that's pretty great. So,
Yeah.
Another question I want to ask is, what are as a dermatologist, let's say you do your MD and you do 1 or 2 year of SRship. So
Yeah.
first question that I want to ask is there any difference if you do a MD dermatology versus a DNB dermatology in terms of your experience or your knowledge?
Actually, I feel that MD dermatology mein thing is that they are mostly in the mostly government institutes, and obviously some private colleges. So I feel the exposure and the academic part is a little more developed. To develop a slightly more clinical acumen and knowledge if you are doing MD dermatology. And DNB dermatology is also not bad. Their course and curriculum is structured in a very good way. Like I just given my DNB practical exam, and it was pretty difficult. Like the standard of questions and the standard of cases were like very good. So, but then I was talking to some of the DNB candidates, and they were mostly complaining that they do not get as many cases as they would have, liked to see and learn about during their in your post-graduation days. Like number of cases coming to the OPD, footfall is a little low, and consultants are also not that many in number. So teaching experiences and learning opportunities are a little limited. But otherwise, if you talk about the course per se, a DNB dermatology course is per se academically structured as good as, I would say, the MD course. So in that way, there is no difference. The exam is also at par. Both the exams are at par.
Yeah, I think that is like a common theme in medical branches, that the exam, the course structured is pretty good, but it is just the patient exposure which is a little bit lacking in a DNB program, right? So, what are in dermatology? What are the future prospects and the salaries for graduates and postgraduates? Yeah.
Yeah, I think that's what most people want to know. So future prospects, like broadly speaking, there are two main things where you can get into. One is if you are academically oriented and you want to remain with your perks and you want to remain in a government setup, that is one option. You can take up a job as a consultant later on in one of the major either AIMS like institutions or in any of the government colleges, and that they also have like similar working hours. You can pursue your academic interests, research work, publications, and obviously seeing patients on a daily basis. That is one. But then obviously this does not pay as much as you would expect a cosmetologist or a dermatologist to earn. It has a standard payment scales of a consultant in a government institute. Moving on to the other aspect is a private practice. So a private practice, actually it takes a little more effort in dermatology, because you have to set up your clinic from scratch, and
sorry, yeah.
Bless you. You need to set up your clinic from scratch, and you need to and there's a lot of equipment involved, like the laser machines and the derma roller, the derma pens, and there's hydrofacial these days, a lot of stuff. So that requires a lot of capital and a lot of building up from the base. But it is very rewarding in the sense that it pays a lot. But again, that per se depends from city to city. Like if you're in a tier 1 city like maybe Delhi and Bangalore and Mumbai, it will take a lot of time for you to establish yourself, because there are already a lot of leading dermatologists in these areas who are well known and they're doing very well. So to establish yourself as a newbie in cosmetology is difficult. and the clientele is also, you know, a more posh clientele, so it becomes very important for you to, you know that mannerisms and counseling and how you speak to them becomes important. But it is rewarding in the sense that it is very well paying. If you are in a tier 1 city, you know, you can earn for one sitting of Botox, you can earn like 20-30,000 per sitting. Lasers
Wow.
also, you know, 5,000, 10,000 per sitting. If you're in a lower tier city, you know, like a town, like even maybe Chandigarh is also pretty expensive, like a much more lower tier city, then you can earn, you know, 2,000 to 3,000 per setting of laser, or 2,000 to 3,000 per setting of a peel, or a, you know, a filler injection. So it depends from place to place also. But yeah, if you are in a tier 1 city or a tier 2 city and you are practicing cosmetology in private, you can easily earn in lakhs, per like multiple times lakhs in a month.
All right.
And
Yeah.
there's a lot of pharma company involvement as well, because, you know, you heavily rely on them for your products as well. So, you know, there's a lot of benefits there, you know, in that sector also.
Okay.
So yeah.
All right. So, I think this is pretty true for all diagnostic, even my branch. If you talk about radiology, so I think the
Okay.
initial investment is a little daunting, it seems, but I think the return on investment for these branches is pretty high.
Is
Which,
very high. Yeah.
yeah, which is not true for a lot of other branches, especially
Yeah.
surgical branches.
Mm-hmm.
Because
Actually, in this one more pitfall in dermatology, that you do not tend to get jobs in private, private hospitals and medicities and all, because there are not many posts created. There are a few dermatologists in such institutions, and they're already like filled. So, as a young postgraduate, you have just passed out after doing your MD, after passing your MD exams, there are a little less opportunities in such a sector. Like, if you know, you can look at branches like medicine and OBGYN and pediatrics. You can easily get a job in a institute like, you know, Fortis or Apollo. They'll easily hire you for 2 to 3 lakhs a month. But as a dermatologist, it's difficult to find a job like that. Like, you are either your best bet is to stay in an institute, do a senior residency, and then move on to a consultant post, or you start your own practice from scratch. So the
all right.
private job sector is not well developed in dermatology.
Okay. So predominantly, options are predominantly focused on entrepreneurship.
Yeah.
Or
Mostly.
mostly, and I think with regards to setting up your own clinic or your own space, I think the advantage that dermatology has that it does not require a lot of space,
Yeah,
right?
it does not. It does not. You can start from a single small room with a table chair, and, you know, you can initially start building a name for yourself. Just look at clinical dermatology cases, regular cases, and then you can slowly build up your cosmetology practice. You know, after you acquire some capital and some confidence, you can build up your cosmetology practice. So that is one way to go at it. But yeah, in order to survive in private, in order to earn, you know, to earn enough to earn a living, a proper living, you need to venture into cosmetology in private, because that is where the money lies. So
Right.
you one will not be earning enough just by, you know, treating fungal infections or by treating acne just with, you know, medications. You will need
Right.
to venture into cosmetology a little bit.
Right. So just a few more questions. So what are the good colleges for dermatology in both INI-CT or NEET PG through in state colleges?
Okay, so INICT, I feel both all three AIMS, PGI and JIPMER. All three of them are like, they are very good. So I have obviously done my MD in PGI, so I am a little biased towards PGI.
Right.
But JIPMER and AIMS also have extremely good courses, and their PGs are very well knowledgeable as well.
Right.
Coming to state colleges, I will obviously have a little limited knowledge in that sector, but the colleges which I know are very good are MAMC and RML Delhi, right? Even BMMC is very good, and most of the the peripheral AIMS are also doing very well these days, like AIMS Rishikesh or AIMS Jodhpur, AIMS Bhubaneswar. They are also upcoming and budding centers for dermatology. Even CMC Vellore is a good center as well. I've seen some of their follow-up cards and all. Very extensive, thorough workup of the patient has been done, and they have good academics as well.
All right.
So, yeah.
So predominantly your PG is predominantly focused on medical dermatology, and your learning of cosmetology is you're self-learning through maybe fellowships
Yeah,
or
yeah, yeah.
internships or
Or
something.
yeah, so mostly what happens is, yeah, you're right. So in the focus in most of the institutes are core clinical dermatology, and after you pass out, sometimes we feel a gap that we do not know cosmetology enough. So mostly what people do is they take they learn under some already established reputed dermatologists. Like many of the reputed dermatologists, they offer some small courses also in their private setups. So it's a 1 month course or a 2 month course. There are fellowships in hair transplant, fellowships in lasers, whatever you want to learn. Obviously these are mostly paid fellowships. So you do a fellowship, and or you can do an informal work experience kind of thing
Observership.
under a, yeah, just an observership, an informal thing. You won't get paid, just to get a hang of it. Or you can learn from workshops and conferences and all. That is also an option. If you talk about like fellowships proper, then there are some fellowships available in AIMS, laser and dermatosurgery, I think. And there is a fellowship in JIPMER of pediatric dermatology, as well as lasers and dermatosurgery. And Bangalore Medical College, yes, Bangalore Medical College is also a good center, and they are also offering a fellowship in lasers and dermatosurgery, as well as aesthetics. And hair transplant fellowships are conducted by various private setups. Like a lot of reputed private setups are conducting like a 1 year, 2 year hair transplant courses. So yeah,
All
this
right.
is like the gist of it. Yeah.
All right. I think so. That was a pretty detailed discussion about dermatology, and I think we
Yeah.
discussed almost everything about dermatology, as a branch to academics to like working hours and future prospects, as well as cosmetology.
Yeah.
So
Yeah.
I think that helps future aspirants and those appearing for NEET PG and NICT counseling. And so thanks a lot, Anubha, for being with me. And
Yeah. My pleasure.
yeah, and good luck for your SRship and your future endeavors.
Thank you. Thank you. Thanks a lot.
Chalo, see you.
Yeah. See you. Okay. Bye bye.
Bye bye.